All right, welcome back. Let's continue on the autonomic division of the nervous system, and we will start this part by studying the sympathetic division. Sympathetic division, or fight and flight division. Now, let's first study what is the effect of the sympathetic division on the different organs and parts of the body. What will happen when that sympathetic division is turned on? Using the scenario that I described at the beginning of this autonomic nervous system part, I will use that scenario of the fire. There's a fire, and then there is this sympathetic system turned on. So what will happen? What will happen to my eyes when it receives that sympathetic innervation? When it receives the sympathetic innervation, I will be trying to escape the danger, right? So I need my pupil to be dilated to the maximum so I can see my options. Am I gonna jump? Am I gonna run, right? So pupillary dilatation or dilation, that's what will happen. And then what will happen to my salivary glands? I don't need to eat, no need for food. So everything related to food and eating, that's related to the parasympathetic, that's rest and digest part of the autonomic nervous system. So the salivary glands and all the GI system, as we are going to see in a minute, is going to be turned off or decreased to the minimum. The activity is going to be decreased to the minimum. So the salivary glands, which is responsible for releasing the saliva, which moisturize or make the food bolus moist, this will be decreased, and the secretion is going to be very thick and minimum. What about the heart? You know, in the emergency situations, our heart is going to start racing, right? It's going to start racing, right? And beating fast. So that's technically called tachycardia, right? Or palpitation, right? So that's what will happen to our heart. What is the aim of that? The heart is aiming to push or just bump like the maximum amount of the blood by increasing the cardiac output. So it's beating hard, so the aim is to increase the cardiac output to deliver more blood and more oxygen, right, and glucose to the muscles, to the skeletal muscles. What will happen to our lungs? If I'm running for my life, right, or escaping a danger, what will happen? I need to dilate the bronchi and bronchioles. You know, there is a trachea bringing the air, and then the main bronchi, right and left, and then the bronchioles. I'm gonna need to dilate those bronchi and bronchioles, right, to the maximum, so I can get the maximum amount of oxygen, taking it to and oxygenating the blood and taking it to the skeletal muscles and the brain. Now, what will happen to the liver? Liver is a storage site for glucose. Glucose is stored in the liver in glycogen. It will be turned into glycogen and stored in the liver. So what will happen? Because in danger, I'm going to need more glucose to be delivered to my skeletal muscles. So I will break down that glycogen. So that process is known as glycogenolysis. I'm breaking down that glycogen and getting more glucose and delivering it to the blood and then to the muscles. Now, what about my gallbladder? Gallbladder, I don't need it now. What I need, I don't need my gallbladder to contract and give me that bile to digest my lipid and my fatty meal, right? I'm not eating, right? So I'm going to relax that gallbladder wall, and I don't need it to contract now. What will happen to my stomach? That peristalsis movement of my stomach, right, which is propelling the food, right? Propelling it and then pushing it down. I don't need it. I'm not eating, I'm not doing anything, right? So I'm going to stop that peristalsis, and I'm going to even close that sphincter connecting the stomach to the duodenum or duodenum, right? And I will stop the secretions or decrease the secretions to the minimum. What will happen to the spleen? What happens to spleen is the blood circulation going to the spleen. I'm gonna vasoconstrict and decrease that blood and diverting that blood to skeletal muscles. What will happen to the pancreas? Pancreas in the beta cells of Langerhans, it contains two types of cells. One of it is alpha cells, which is responsible for secreting glucagon, which increase the blood glucose level. And there are the beta cells, which is responsible for secreting the insulin, and that insulin should enter that glucose into the cells. But I don't need to enter that glucose into the cells because that process is in the rest and digest. That's in the parasympathetic, because that's needed to build my body. I don't need to build my body now. Now I need the maximum amount of glucose because I want to provide it to skeletal muscles because I'm running, right, for my life. So what will happen in the pancreas? I will turn on the alpha cells, which secretes the hormone glucagon to increase my glucose, my blood glucose level, right? And I will decrease that beta cells, or maybe at some situations turning it off, right? But decreasing that beta cells secretion of insulin hormone. What will happen to my intestine, small and large intestine? I'm not enjoying a meal. I'm not even needing any absorption of these nutrients now, right? So I will decrease the amount. The sympathetic will decrease the amount, the peristalsis movement, right, and the absorption, right, of the nutrients. And even that amount of blood is going to the intestine. It will just be diverted to the skeletal muscles. Now, regarding this GI system here, what will happen to the rectum? Rectum, I mean to the here, like at the bottom here. What do I have? I have two sphincters, right, at the anal canal and anal verge. I have internal sphincter, which is involuntary, right, and external sphincter, which is voluntary. So when the sympathetic system is turned on, the internal sphincter, which is involuntary, is going to be tightened, is going to be closed. No way, we don't have time to defecate or pass any stool now, right? So the internal sphincter is going to be tightened and closed. The external sphincter, by the voluntary muscle, also the person can close it by himself, right? Because there's no time for that. This is for rest and digest. This is for the defecation and urination for the parasympathetic turn. Now, what will happen to my suprarenal medulla? My suprarenal medulla is going to receive this sympathetic, and then it will release hormones in the circulation. It will release epinephrine, right, and norepinephrine, or adrenaline and noradrenaline in the circulation, and that will make a mass effect of sympathetic effect. That's why the sympathetic is stronger and it's long lasting than, it lasts longer than the parasympathetic, because the adrenal medulla, because the parasympathetic is gonna activate the certain organs. It has a nerve fiber going to that organ. It will affect that organ. Also, the sympathetic, it's affecting certain organs, except this suprarenal medulla. It will secrete the epinephrine and norepinephrine in the circulation, and that's gonna go everywhere in the blood, and that's gonna have a mass effect, and that effect is gonna last longer. Okay, and then what will happen to my kidney? It's not time for passing urine. It's not time for urination or micturition. That's why the blood flow going through the kidney to be filtrated is going to be decreased to the minimum, right? And then even this peristaltic movement of the ureter, which is milking the urine and bringing it down, no, we don't want it. It's going to be turned off, right? And what will happen to the urinary bladder? For a person to pass urine or micturate, two actions should happen. First one is there is a muscle which is part of the wall of the urinary bladder. Urinary bladder wall, there is a muscle there. It's called the Troser muscle, right? And there is a sphincter here, internal sphincter and external sphincter, right? The internal sphincter is involuntary, the external sphincter is voluntary. So for a person to pass urine, what will happen? The detrusor muscle, which is part of the urinary bladder wall, should contract and evacuate that urine. What will happen to the internal sphincter? Internal sphincter should open, right? That's involuntary. And the external sphincter, which is voluntary, should be open too. So that's what will happen when a person is passing urine. Now, in sympathetic system, when it's turned on and the person is running for his life, or there is a danger or whatever, right? When the sympathetic system is turned on, what will happen? I don't want to pass urine at that time. So what will happen? The urinary bladder wall, the detrusor muscle is going to be relaxed. I want to keep that urine inside. So that muscle is going to be relaxed. What will happen to the internal sphincter, which is involuntary? The sympathetic system is going to tighten it. It's going to be closed, right? And the external, you can close it by yourself. Very good. Now, what will happen to the genitalia in male and female? What will happen in male is more prominent than what will happen in female. What will happen in male? Of course, in male and female, there is erection, right? Because the equivalent part to the penis in male is going to be the clitoris in female. So what will happen in that erectile tissue, whether in male or female? Let's say this and make it clear. Erection is a function of parasympathetic, while ejaculation is a function of the sympathetic, right? Erection is a function of parasympathetic, and ejaculation is a function of sympathetic. That's why I will just give you some clinical hint here, tip that will make you memorize this easier. Some of the patients who complain of what we call erectile dysfunction, okay, or inability to achieve erection, that might be due to stress, right? Stress, like if a person is stressed in his work with his boss, or is stressed, let's say, at home with his partner and this and that, then his sympathetic division will be turned on, right? Stress will turn on the sympathetic, and anxiety and this and that, right? And this will prevent the erection, right? So a person might go to the office, at the doctor's office, right, complaining of a problem in erection, because his parasympathetic is turned off and sympathetic is turned on because of the stress. Stress will turn on the sympathetic, right? Now erection and ejaculation, we're done with that. Now we will move to the next. Now in this picture, I tried to explain the final or the terminal effect of the sympathetic system on the different organs. But how does it happen? Like from the spinal cord, how does it go all the way to reach these organs? This is what we will discuss in the next few minutes. Now, the sympathetic division of the autonomic nervous system sends several branches to several structures, including the following. This is what we are going to focus on in the next few minutes: the para-vertebral ganglia, skin, pre-vertebral ganglia, adrenal or suprarenal medulla, or medullae, because there are two. I would like you to differentiate between the para-vertebral or para-vertebral ganglia and pre-vertebral ganglia. Now, let's start with this para-vertebral ganglia. What are these? Para-vertebral ganglia are these ganglia on each side of the spinal cord, right? So this is a ganglia, this is a ganglia, this is a ganglia, this is another one, this is a ganglia. These swellings, right? And it's paired, it's on each side, right? Good. Now, it's called sympathetic ganglia, sympathetic chain, sympathetic trunk, or para-vertebral ganglia, or para-vertebral ganglia. Now, what will happen? This is a spinal cord. I'm going to have a lateral horn here. From the lateral horns, right, in the thoracolumbar area, because sympathetic does not come from cervical area. It never comes from the sacral area. It's only in this area which we call thoracolumbar area. That's why the sympathetic is called also thoracolumbar outflow, right? It comes from thoracic and lumbar, T1 through L2. Now, the preganglionic fibers comes from the lateral horns. Here, this is the preganglionic, and then comes to these para-vertebral ganglia on each side, and then it synapses with it, right? And then from there, I'm gonna have my post-ganglionic fibers going out. Let's say this one more time. From the lateral horns of the spinal cord, I'm gonna have in the thoracolumbar, not in the cervical, not in the sacral. In the thoracolumbar area, I'm gonna have from the lateral horns the preganglionic fibers coming out. And then when they reach these ganglia on each side, they will synapse with it. Then the preganglionic fibers ends, and then the black here, what starts is gonna be the postganglionic. So the one in the red color, that's preganglionic. The one in the black color, that's the postganglionic fibers. Now, the preganglionic fibers are going to use the acetylcholine as a neurotransmitter. The postganglionic is going to use noradrenaline or norepinephrine, right, as a neurotransmitter. One more time, the preganglionic are the one in red, postganglionic are the one in black. The preganglionic are going to use the acetylcholine as a neurotransmitter, and the postganglionic, which are in black color here, is going to be using the norepinephrine or noradrenaline as a neurotransmitter. Now, the postganglionic, where is it going? It's going to certain organs and areas, right? It's going to go up to the eye, to the head and neck, right? Head and neck structures, mainly the eye, right, and the salivary glands, right? And it's gonna go in the thorax area. It's gonna go to the heart and to the lungs through what we call cardiac and pulmonary plexuses, right? Let's say this one more time. The postganglionic, where does it go? It goes to the head and neck, namely to the eye, right? To cause the pupillary dilation, right? To the salivary glands to decrease the secretion. It will go to the cardiac and pulmonary plexuses to cause the palpitation, right, and heart racing, and to the pulmonary to make bronchodilation. Very good. Also, it goes to the skin. It goes to the skin, right? What is it gonna do in the skin? We're gonna know that in few minutes. But in general, head and neck, right? Heart, lungs, and skin. Now, let's see what will happen in the skin here. In the skin, as we mentioned earlier, this is, what did we name? What did we call this? This is a preganglionic fibers coming from the lateral horns and synapsing with the para-vertebral ganglia. This one is the para-vertebral ganglia, right? Now, in black color, what will happen? These are the postganglionic fibers, right? This one is going to use the acetylcholine, right? Let's see what this one is going to use. The postganglionic fibers coming from here, where is it going? It's going to certain structures. It's going to the sweat gland. It's going to this muscle attached to the hair follicles. This muscle is called erector pili. Erector pili is the muscle attaching to the hair follicles, right? And this is a sweat gland, right? And this is a blood vessel running in my skin. Very good. Now, when the sympathetic innervation reaches to those structures, what is it gonna do, right? You're in fear. You're in danger, right? You're in fear. What will happen to your sweat glands? It will produce more sweat, right? So you're going to be sweating, right? So now what will happen to your hair? Like through this muscle, which is erector pili, the hair is going to stand, right? The end of the hair is going to stand. That's what we call goosebumps, right? That's what will happen. And then what will happen to your blood vessel? The blood vessel is going to constrict. Why? Because I don't need my blood. I don't want to let my blood to go to skin. I want to divert it to a more important structure that's going to help me in running for my life. That's going to be the skeletal muscles, right? So what will happen here is going to be vasoconstriction, or narrowing of the blood vessels here, right? Very good. So the effect on the skin, right? As we said here, is preganglionic, coming from T1 all the way to the L2. All those, they can synapse and go to skin, right? From T1 to L2, all of them, they can synapse in the para-vertebral ganglia and go to skin as postganglionic, right? The one which is regulate the body temperature, we call it pseudomotor. The one which regulate the blood vessels, like constricting and dilating, that's going to be the vasomotor. And the one which is attached to the muscle of the hair follicle, we're going to call it pilomotor. Okay. Now, we discussed this para-vertebral already, right? We mentioned this ganglia, this ganglia, this ganglia, this ganglia on each side. We call it para-vertebral, and we're done with that. And we have seen where does it go, right? Head and neck and skin, right? And heart and lungs. Now let's see what's pre-vertebral or collateral ganglia. When we say pre-vertebral or collateral ganglia, we mean those three: celiac ganglia, superior mesenteric ganglia, inferior mesenteric ganglia. Those are the pre-vertebral ganglia. Now, in the para-vertebral ganglia, they were paired. They were on each side of the spinal column. But when it comes to the pre-vertebral ganglia, they are unpaired. There is one of each. It's just in front of your vertebral column, right? So you're going to have your celiac ganglia, you're going to have your superior mesenteric ganglia, and inferior mesenteric ganglia. Those are unpaired pre-vertebral or collateral ganglia. Now, in general, those three guys, they are going to provide sympathetic innervation to where? To abdomen and pelvis. All the abdomen structures and organs and pelvis structures and organs, they're going to receive their sympathetic innervation from the celiac ganglia, superior mesenteric ganglia, and inferior mesenteric ganglia. Now, let's go into few details. Now, what about the preganglionic? What about the postganglionic? Preganglionic will come from T5, T6, T7, T8, T9. Those guys from T5, T6, T7, T8, T9, they will come together. What are they going to form? They're going to form this greater splanchnic nerve. Greater splanchnic nerve. Again, the preganglionic fibers from T5, T6, T7, T8, T9, they will come together to form the greater splanchnic nerve, which will synapse in the celiac ganglia. And from there, the postganglionic fibers are going to go to the abdomen and pelvis. Done with that. Let's move to the next. The preganglionic fibers from T10 and T11, they will come together to form the lesser splanchnic nerve. Lesser splanchnic nerve, which will synapse with the superior mesenteric ganglia. And then the postganglionic fibers in black here, they will go to the abdomen and pelvis. Done with that. Now, from T12, L1, L2, the preganglionic fibers, they will come together to form the lumbar splanchnic nerves. It's not one. There are more than one. That's why we call them nerves. Lumbar splanchnic nerves, right? And those preganglionic fibers will synapse with the inferior mesenteric ganglia. And then they will go to the abdomen and pelvis structures, right? Very good. Done with that. So, let's just conclude. Pre-vertebral or collateral ganglia are three, right? Celiac, superior mesenteric, inferior mesenteric ganglia, right? What about the preganglionic? Preganglionic for the celiac is coming from C5, C6, C7, C8, T5, T6, T7, T8, T9, right? And what about the superior mesenteric ganglia? What about the preganglionic fibers to the superior mesenteric ganglia? It's coming from T10 and T11, right? And then T12 and L1 and T12 and L1 and L2, those are the preganglionic, going to synapse with the inferior mesenteric ganglia. All of these ganglia, postganglionic fibers, are going to the abdomen and pelvis. Done. Now let's discuss the suprarenal medulla, or medulla, some people pronounce it like that. What will happen? As you can see here, from my greater splanchnic nerve, right, there will be a preganglionic that does not synapse with the celiac ganglia. Look at that. It does not synapse. All those of the greater splanchnic nerve, T5 through T9, the preganglionic fibers, they will synapse with the celiac ganglia. And then the postganglionic fibers are going to the abdomen and pelvis, right? But there is one preganglionic fiber coming from this greater splanchnic nerve. It just bypasses the celiac ganglia. It passes without synapsing. It goes all the way as preganglionic and red in color here in this picture, going all the way to the suprarenal medulla or medulla, right? When you go to the suprarenal medulla, the chromaffin cells inside the suprarenal medulla are going to be the cells where it's going to synapse. So the preganglionic fibers going to the suprarenal medulla or medulla, it reaches the target organ, which is the suprarenal gland itself, right? And it synapses within that gland, right, with the chromaffin cells. So the chromaffin cells inside there, they're going to be like acting like the ganglia, right? And from there, am I going to have a postganglionic fibers? No. Then after this synapsing, there will be a release of hormones, right? That's going to be the norepinephrine and epinephrine, right? Hormones, or adrenaline and noradrenaline, they will be released into the circulation directly, and this will create what we call the mass effect of the sympathetic division of the autonomic nervous system. And this is unique to the sympathetic. We will not have a mass effect in the parasympathetic, right? And that's why the sympathetic lasts longer than the parasympathetic. Okay, now here let's take a look at the preganglionic and postganglionic. Again, what do we mean by preganglionic? Those red in color coming from the lateral horns, right? And in the case of para-vertebral or para-vertebral ganglia, they end there, and then the postganglionic will be in black color, right? In case of the pre-vertebral, they will go all the way. They will bypass that para-vertebral. The preganglionic will go all the way, and then they will synapse with the pre-vertebral ganglia, greater, lesser, and celiac ganglia, and superior mesenteric and inferior mesenteric ganglia. Now, what about the neurotransmitters? The neurotransmitters, now we are talking about the sympathetic, right? Sympathetic. The neurotransmitter, the preganglionic will use the acetylcholine. The postganglionic will use norepinephrine or noradrenaline, right? Let's say this again. Preganglionic will use the acetylcholine, right? And the postganglionic will use the norepinephrine or noradrenaline. It's the same name. Good. Now there are exceptions. There are exceptions, and exceptions are important, especially for the purpose of the exam, right? What are the exceptions in the sympathetic system in using the hormones, neurotransmitters? The sweat glands is one of these exceptions. The sweat glands is going to use acetylcholine in the preganglionic and acetylcholine again in the postganglionic. Let's see this. Let's say this. See this here, right? So this is my sweat gland, right? So the preganglionic coming to the para-vertebral ganglia here is going to be acetylcholine, like like the entire sympathetic system, in the preganglionic is acetylcholine, period. Now, going to the sweat gland, the postganglionic will be what? Will be acetylcholine again. Acetylcholine again. So the sweat gland is one of the two exceptions in the sympathetic system. So in the postganglionic, instead of using noradrenaline or norepinephrine, it uses acetylcholine again. Okay, this is one exception. What is the other exception? The other exception, already we have talked about it. That's the adrenal medulla, right? So in case of adrenal medulla, the preganglionic will be this red one, right? It will bypass the celiac ganglia. It will go all the way as preganglionic, and it will end in the organ itself, right? In the suprarenal medulla. The exception is I don't have a postganglionic there, right? And then instead of releasing, it will release the epinephrine. So those are the two exceptions. Now what about now we're done with the sympathetic, but since we're here, let's talk about the parasympathetic and the somatic, right? The parasympathetic is consistent in using the neurotransmitters. It's going to use in the preganglionic acetylcholine and in the postganglionic acetylcholine all through. It doesn't have any exceptions. That's good, right? Cool for the parasympathetic. In the somatic, I have one neuron, because in the autonomic I have two neurons, preganglionic, postganglionic, right? But in the somatic, like going from the anterior horn or ventral horn, going to the muscle, skeletal muscle, right? I use only one, because I have one neuron, right? One motor neuron. I'm gonna use acetylcholine in that consistently. Okay, so neurotransmitters. We're just here. We're just concluding what we were saying. In the sympathetic, we use both acetylcholine in the preganglionic and adrenergic, that's noradrenaline, right, or norepinephrine, right, in the postganglionic, right. All preganglionic is acetylcholine. We just agreed on this, right. All postganglionic are noradrenaline, right, noradrenaline or norepinephrine, right. One exception is the postganglionic sympathetic fibers for the sweat glands, right. It's going to be acetylcholine, right. We have just seen that in a minute, 1 minute ago. It causes adrenal mass reaction throughout the body. This is unique to sympathetic. We don't see this in parasympathetic. Why? Because it secretes this adrenal medulla is going to secrete the epinephrine in the circulation. Sympathetic effects are of lasting duration, right? It lasts longer than the parasympathetic because of this mass effect and because of release of the epinephrine in the circulation. Finally, here also we are concluding what we have been saying. So what am I going to have? I'm going to have the preganglionic neurons, right? Where they originating, they are coming from the lateral gray horns of spinal segments T1 to L2. That's why we named it. We called it thoracolumbar because it's coming from T1 through L2. Good. What will happen? Those are my preganglionic in red here, right? Then it can go either to, in case of para-vertebral ganglia, it goes to the para-vertebral ganglia, that's sympathetic chain ganglia, paired on each side, right? Or it can go to the pre-vertebral or collateral ganglia, right? Those are unpaired, right? Or it can go to the suprarenal medulla, right? That's paired, right? We have seen that. Now the postganglionic here is going to be what? It's going to be the noradrenaline, right? Noradrenaline, right? And it will go to the target effects, right? So those which go to the para-vertebral is going to go to the thoracic cavity, head and neck and wall and limbs, right? And skin too. So the collateral ganglia, the postganglionic, they will go to the visceral effect and in abdominopelvic cavity. We have discussed that already. Those are the celiac, superior mesenteric and inferior mesenteric ganglia, right? The postganglionic is going to go to the abdomen and pelvis. And now the suprarenal medulla is going to, through release of hormones to circulation, so it's organs and systems throughout the body. That's the mass effect, which is going to last longer, right? Done with that.